Okay, welcome everyone to today's Ask Me Anything session. We have Dr. Vinita Dubey from Toronto Public Health joining us once again. She is the Associate Medical Officer of Health for Toronto. Welcome, Doctor.
Thank you. Thanks for having me again.
So my name is Dilshad Burman. I will be moderating this chat. I'm a web writer with CityNews and 680 News. The chat is going to include tons of questions that were submitted by our viewers and listeners over the past week. If you didn't have a chance to submit your questions, you can still do so in the comments on this post, as well as in our article on our website. So keep them coming. We'll try and get as many as we can answered. Doctor, are you ready?
I'm ready.
Okay, wonderful. Let's get started with the first question. This week, we got a lot of questions about convalescent plasma. So we have two from both Donna and Stuart, which are basically the same question. Firstly, could you explain the concept of convalescent plasma? And also, how is it effective in helping the recovery from COVID-19?
So if you have COVID-19, your body will try to fight the infection. And the way it does that is by producing antibodies. That's your body's natural army that comes to attack the virus. And once you've fought the infection, you have those antibodies that your body produced in your blood system. The antibodies are in the serum or the blood. And so what researchers and scientists are doing is they're asking for blood transfusions for people who have recovered from COVID-19. And those antibodies that your body used to help you fight the infection can then be used to help someone else fight a COVID-19 infection. And in particular, for someone who might have a weakened immune system or might have a really bad infection where their body is struggling to produce those antibodies, they may be very impactful.
So this has been proven to help with COVID-19 recovery then?
They're using it now they're using it because they're hopeful that it's going to work. To actually see whether it actually makes an important impact in people's outcomes is something that they're studying now, and we'll have to see if it does work. We do know that we can use antibodies that people produce for other illnesses, even for other infectious diseases. We use it for measles, for hepatitis A. So it is something that we've done in the past. We make sure that when you get the blood transfusion that it's sort of cleaned, it's made sure that it's free of other infections as much as possible. And then they're trying to use it. It's in a situation where you don't have a specific drug that you can use to treat these infections that we try using things like blood products.
Right. So then in connection to that, there have also been a ton of questions about antibodies. Are we already testing in Toronto for antibodies? And if so, where can people go to get tested? How can they donate blood plasma?
We don't have a test right now in Toronto for antibodies. Health Canada has actually just made an announcement, and we're just waiting. There are a number of tests that are available for antibody testing, and we need to make sure that when you actually say you got your antibodies, you had a blood test to see if you have immunity through antibody testing, that it's actually going to give you the right result. So we don't have that available, but what we do know is that if you had COVID-19 and you give blood, that it's more likely that you might have created antibodies, and so that's one of the questions that would be asked when you give blood.
Okay. Moving on, we've got a few questions about easing up restrictions because we've been hearing about the province sort of phasing in opening up certain businesses. So one person says, who is this? Iqbal. Iqbal asks, since the stay-at-home restrictions are starting to ease up, how long before we can visit our loved ones in long-term care homes?
So the restrictions right now, haven't been, we're easing to lift restrictions. And I think what's important to know is that we can't ease restrictions completely unless we have the virus, almost gone or at very low levels in Toronto especially, and for the rest of Ontario. Something like going to visit your loved one in a long-term care home is one of the restrictions that may take a while to be lifted, especially in those situations where there's an outbreak in the facility. Because what we want to do is in these long-term care homes, we want to be able to put up a fortress around the institution to really protect these individuals who are extremely vulnerable. And we know that visitors have sometimes brought the infection into these facilities. So right now we still have a number of long-term care homes that have outbreaks in these facilities, and until those numbers go down, we can't consider easing those restrictions. So it's going to be for a little while longer.
Absolutely. So in connection with that, then Tony asks, everyone is thinking about returning to normal, but in your opinion, are there things that shouldn't be returned to at all? What are some of the new practices that we should keep going forward?
Right, that's a good point, because we're actually going to be talking about the new normal. What's it going to look like? We're probably not going to go back to the way we used to do things before COVID began, because there's always going to be that ongoing risk that you could catch this virus. So things like physical distancing are going to be part of that new normal, keeping 6 feet distance wherever you can, washing your hands often. If you're sick, even with just a sore throat and a runny nose, you have to stay home now, because that could be COVID. And we want to make sure that you don't spread it to others. If you're, elderly, or you're otherwise have a chronic health condition, you're going to want to take even more precautions than you did before to make sure that you don't get this virus. And as well, if you're in situations where it's difficult for you to keep that physical distance, you're going to want to consider wearing a cloth mask or a face covering.
So this is kind of in connection, I guess, then a lot of people have asked, when can I go out to see live music again? When can I go see my friends again? If we're going to continue physical distancing for much longer, that's going to be a ways away.
We're going to start easing up on restrictions as the virus starts to decline, and we have a number of other things that are in place to make sure that if the virus comes back, we're ready to respond. And so that includes having capacity in our healthcare system. So if we see an increase in cases, we know that our healthcare system will be able to adapt, for example. And to make sure that we have good testing in place and actually good monitoring in place, so that we make sure that we will catch any new cases that come on board. So we're going to have those things in place before we can ease restrictions.
Right.
But even until we have a vaccine or a good treatment for this medication, those very large gatherings are going to be high risk, because when you have a lot of people coming together, and even if you say, well, don't go if you're sick, you can actually spread it before you even have symptoms. And so we don't want to go that far just yet. And hopefully one day we'll get there. But right now, we just have to stay the course. And so we have to stick with our household contacts, no larger than 5 groups. And as our infection rate goes down, we'll be able to open things up more.
So speaking of staying the course, then we've got a question from Doug, who says, this question is from L. L asks, if the curve is flattening and the case numbers are starting to drop, wouldn't this be the optimal time to increase social distancing and lockdown measures in an attempt to stifle the spread even more, rather than open things up again right now? If we're dropping, why not just double down?
There's no question that the measures that we've asked people to take to stay home, to not travel, travel restrictions, those have definitely worked. We know that in the middle of March, each case of infection that we had ended up in 3.5 other new infections, whereas now each case is ending up in only 1 new infection. So we know that those measures have worked, but we have to be able to balance the strictness of the measures with, economic activity and people's livelihoods and people's mental and physical health. And so that's that constant balance. We know that there are things that we can do if we get new cases to be able to make sure that we respond right away. And so easing restrictions, I think, is a really good way, rather than opening things up all the way and then having to go back all the way. Taking a more gradual approach is going to help us, but keeping people locked indoors for longer than keeping people locked indoors for too long, then people are going to lose interest in that, and then they're not going to be able to follow the recommendations. So we have to be able to balance all of these things.
Absolutely. So the next set of questions is about testing for the virus and why everybody is not getting tested. Doug asks, if it's true that COVID-19 can be spread by people who are asymptomatic, why isn't everybody getting tested? Shouldn't we at least make an effort to test all essential workers, maybe starting with healthcare workers, then moving on to grocery store workers? And just a connected question, Annette asks as well, in other countries, they're testing everybody. Why aren't we doing that in Toronto so that we can identify, COVID cases before they start spreading?
These are really good questions about testing, and our testing strategy is certainly one of the really important things in order to be able to combat this disease. What we are doing now is moving towards testing everyone who has symptoms. We're getting the lab capacity on board. And so I think the first step before we test everyone, people who don't have symptoms, we need to first start making sure that if you have 2 or 3 COVID symptoms, that you can go to an assessment center and get tested for that. So that's one of our next steps in testing. The guidelines for testing are actually put out by the Ministry of Health. Mm-hmm. And so we wait for their guidance before we open up recommendations for testing. I think what we have to realize, though, is testing everyone in Ontario today. Yes. The results are only as good as today. And the test that we have only checks to see if you have virus at the back of your nose at this very instant. And so if you're incubating, meaning you've been infected with the virus, but it's still, has not developed into a place where you're contagious, then tomorrow or the next day or the next day after that, you could be contagious, even though you had a negative result today. And so I think we have to understand that testing everyone, even without symptoms, is not always our best use of testing right now, because in a day, in a week, in 2 weeks, in 3 weeks, all of that testing might not be important, and we might have to consider what our next steps would be. So I think to answer it in sum, let's first move so that people who have symptoms can get tested.
So just going back a little bit, you said if you're tested and you're asymptomatic, you will likely have a negative result.
If you're tested and you don't have any virus inside you, you could be negative. Or if you're incubating the virus, you're not yet contagious. You're not 48 hours before your symptoms start. You could still be negative and still end up with symptoms or be contagious 2 days later. Oh, and so that's why we say that negative test is only as good as the day that it was done. Right. Because in a day or 2 or 3, things could change in your body and you could get symptoms and then need to be tested again.
Okay, so speaking of symptoms, then we have a question coming in right now. I'm hearing a lot about children being affected differently than adults. What would I be looking for symptom-wise in my children? The information coming out on how it affects children is very terrifying.
Yeah, so I think what we find in general for infections is the very young and the very old can sometimes have what we call atypical symptoms. Mm-hmm. And so sometimes they can just be really tired. They're not waking up. A child that's not running around or wanting to play, well, that's worrisome. And that may not be something that you or I have as a symptom, but maybe something that a young child might have. Mm-hmm. Or a child that might be acting confused in some way or not wanting to do their regular activities. Those might be some other symptoms beyond the cough, sore throat, runny nose, symptoms that a child could have, and things to watch for.
Okay. Then let's talk a little bit about recovery then. Lucy asks, obviously this has many variables, but generally speaking, how long does it take for the virus to be completely gone from your body, barring any complications? If one was sick in Feb and now seems fine, would it stand to reason that the person is now free of the virus?
Yes, so actually we say that in 14 days, most people are actually free of the virus. And no longer contagious. So the day that you get your symptoms is the first day, or day 0. And so 14 days after that, if your symptoms are better, the only thing you have left is a lingering cough, but all the rest of your symptoms are gone, then you're no longer contagious. So it takes 14 days.
Okay. We've got Jerry who says he's a 67-year-old senior. And he has taken some pneumonia vaccines. will that give him better protection against COVID-19 as opposed to somebody who hasn't had any vaccines?
Definitely recommend that the routine vaccines are something that we should all make sure that we stay on top of. And so what people call the pneumonia vaccine is usually a pneumococcal vaccine, and it's given at 65 years of age. And what it prevents against is severe pneumococcal is a bacteria, and it prevents that severe bacterial infection. And so getting that vaccine is still important, because when you get a viral infection, the viral infection could be the first infection you get, but you can get what we call a secondary bacterial infection. And so that pneumococcal vaccine can help prevent that secondary pneumococcal infection. And so if you're 65 and older, you should still make sure that you get that for sure.
Okay. Now we have more questions about when things are going to open up. One of the questions is, from SB79, will indoor summer camps be happening this summer?
The issue on indoor summer camps is complicated, and we're certainly working to come up with solutions or thinking about how can we move forward. I think we have to recognize that we're going to be in the new normal state, and we have to see, are schools going to open? What are schools openings going to look like? We've seen in Quebec that while schools have opened, it looks very different from when schools were in session in February and January. And so I think when planning for summer activities, what's going to open in the summer, we have to think about what we can open and what we can do safely, because the last thing we want is to be able to have children together, families together, and then the infection to spread, and people get sick and really sick, and we could have prevented that.
So in short, probably not. Summer camps are probably
in short,
not.
There will be announcements coming out, decisions, we're working with, providing public health advice, providing operations advice. And so there should be some more guidance on this coming out shortly.
Okay. John asks, I guess everybody's going stir crazy. John asks, when are nightclubs going to open? Can they open in the next phase?
South Korea, which is one of our model countries in the world, who's been really good at being able to kind of contain this virus. You may have heard that they opened up things like nightclubs, and then they've had an outbreak of this infection related to the nightclubs. And so again, thinking about that new normal in a nightclub situation where you're in close contact, you can't maintain that physical distance. Those can be situations where the virus can spread, and we've seen it most recently occur again in a place like South Korea. And so it may be still a little while longer for things like that.
This is an interesting one that's coming in just now from Facebook. Can I safely let neighbors or friends use my pool if families are using it separately and at different times, or could the virus linger in the water? We've also had another question about whether the virus can linger and live in the water, and if so, how long?
So what we know so far is that pools that have chlorine or bromine that are well maintained that way are less likely to grow COVID-19. Right. So the pool water that's well treated is less likely to be the risk in a pool situation. But in a pool, again, maintaining that physical distance is going to be important, just because you're in the water. But if you're in close contact with someone, you can still catch the virus that way. Right.
And I don't know, I mean, depending on how large your backyard pool is, that's going to be hard to maintain the 6-foot distance for sure.
That's right.
Okay, this one is about travel, a slightly different tack. John asks, where are the 8% of travel-related cases coming from? Like which country? Are these essential workers that are crossing the border daily? Because non-essential travel has essentially been stopped.
So our travel-related cases are actually more indicative. That's of all of our cases, and we've had 7,775 cases in the city of Toronto. And at the end of February and beginning of March, 90% of our cases were either related to travel or people who had close contact with someone. But now there are restrictions on travel. And so the percent that are made up our travel are largely related to people who traveled before the travel restrictions, but they still made up a large proportion before those restrictions. Because as you said, there are not a lot of people who are traveling these days. And people who are traveling, you know, unlike in February and the beginning of March, travelers were not required to self-isolate for 14 days, but now they are. And so people who are traveling these days, again, when they return, are required to be in self-isolation for 14 days.
Right. And again, in those 14 days, they might test positive, and that's where that number is coming from.
The new cases, that's right, yeah.
Here's another one about opening up again. It's just come through. Do you think that Universities Ontario will start on-campus classes in September? From Wendy.
Yeah, I mean, what we do with all kinds of schools, elementary and high schools for the rest of the school year, colleges, universities, it's again, a wait and see approach. I think the distance learning, learning remotely is really great that we've started that, because regardless of what happens, at least the learning can continue. But we recognize that, you know, being on campus and learning with your colleagues and your classmates is something that's important, but we're going to have to, I can't tell what it's going to be like in September. And so we're going to have to see what it's like in September or by the end of this, even the summer, before we can give our recommendations there.
Right. Charlene asks that she lives in rural Ontario, which has a low risk of COVID, but there's obviously still a risk. She needs to know what she can say to her cleaning person before allowing her to come back and clean. What are the kind of precautions that she would have to take?
So the risk, again, from getting COVID-19 is from that face-to-face, that close contact, being within 6 meters with someone, what we say for a prolonged period of time. So, you know, more than just a couple of minutes together. So I would say if you need help in your house, and when restrictions are opened up and we say that it's safer to do that, keeping that distance with people who are providing you help in your house is important. Again, common surfaces, cleaning those up afterwards, making sure that you wash your hands, that people who enter your house wash your hands. Those are all good precautions that we can take in those situations.
Okay. Both Cindy and Angel have a question regarding hallway vents and air transfer. Angel says, we have air conditions and heaters in hospitals, at schools, various buildings, and they transfer air from one room to another. Air is basically circulated. So can this lead to the spread of the virus essentially, and how do we mitigate that?
So as far as we know right now, the virus is not spread through the air. And so good ventilation is definitely important. It's spread through those droplets that come from someone's mouth. Classically, we say that they're heavy droplets. So when they're in the air, they fall down. And that's why we don't think that they linger in the air and that it's much of a risk with, you know, in buildings or shared ventilation systems. That being said, it's still a new virus, and it's something that we're going to have to keep track of, especially, you know, as the summer comes and we may have air conditioning, to be sure, because to be sure that it isn't a risk. But as far as we know right now, it is spread through the droplets, and it's not spread and circulated through the air.
We've seen a lot of questions also about, like you said, they don't spread through the air, but we're hearing that certain studies are saying that the droplets linger in the air longer than other viruses. Is that a concern? Does that then mean that it is or can be airborne?
Well, I'm not sure. When it lingers in the air, does that mean that it's airborne? Airborne means that if it lingers in the air and you breathe that air, you will get infected. And we're not necessarily seeing that right now, but that's something that we have to keep an eye on. I think that's why things like opening windows, getting, you know, having air circulating is always a good thing. Okay. But right now there's no evidence that it's being spread in that way.
Okay. In fact, that was one of the questions we had. Can I open my windows to let in fresh air?
Absolutely. Yes, absolutely. Absolutely.
Okay. Jonathan asks, I take the bus everywhere, and I understand that there is a distance that you have to stay away from other riders. But once you're on the bus and you sit down, perhaps the seat could have something on it. What are the kind of precautions you have to take on public transit?
So sitting on a seat is actually not necessarily a risk. If there's contamination in the area, just make sure that your hands, you don't touch your eyes or your nose or your mouth when you're on the transit, and make sure after you use transit that you wash your hands right after. We also do strongly recommend that if you're in a place where you cannot keep a physical distance of 6 feet from others, that you consider wearing a cloth mask or a face covering. And so that's something else that you can do on transit as well.
Speaking of masks, we had a couple of questions about masks. Cloth masks are reusable. But if you were to say use a surgical mask, which of course we're trying to save for the healthcare workers, but if you happen to use them, are those reusable?
Disposable masks are not reusable, no. So they are classically one-time use. You can put one on and wear it for the whole day, but if you're constantly taking it off and putting it on, you have to be careful not to contaminate the mask, because one side of the mask is dirty from the germs from outside, and the inside of the mask is dirty with your germs. And so what you want to do is you don't want to make sure that you mix those up. And so that's one of the reasons why single-use masks for the public should be used only once. The cloth masks are helpful because you can use it if you have two different colors or fabrics, you know which side goes to your face, and then you can wash it. You can wash it with hot water by hand, or put it in the laundry so that it's ready for use the next time.
And when you use cloth masks, do you recommend using a new or a clean one each time you step out, or can you come in, take it off, put it back on, and go back out?
If you have a bunch of them that you can put away and then use a new one, that's certainly preferred. If you're going to reuse it, what I would suggest is that you fold it up so that you know which side is the inside, or put it in a Ziploc bag and know which side is the side that goes on your face. What I wouldn't recommend though is that you just put it in your pocket or hang it on from your ear. Again, using masks properly is really important, because not using masks properly can sometimes contribute more to spreading some of these germs. And so we have some really good information on our website on how to put on a mask, how to take it off, and how to use it properly.
Okay, that's really good to know, because all of us that are trying to save the surgical masks for healthcare workers and using cloth masks, even that needs to be used in a particular way. That's
right, yeah. And don't put your mask on your forehead.
Right, yeah, that's probably not going to work anyway.
Yeah.
So speaking of PPE, then this one is actually from our newsroom. Our producer, Victoria Reve, is asking, once non-essential healthcare workers are allowed to go back to work, such as chiropractors or massage therapists, physiotherapists, who is responsible for ensuring that they have enough PPE for them? Because many of the professions are independent, they don't have big unions or groups that they belong to. So is the city sort of stepping in to help these kind of non-essential healthcare workers?
So right now, those types of settings have not been opened up. And I think that making sure, if they're going to be opened up and you're in close contact with these people, making sure that we have the right precautions in place. Some of it might include PPEs. Some of it might also include what we call engineering control. So you see in the grocery store, they have the plexiglass up. What are the kinds of things that we can put in place in some of these businesses to help to prevent the spread without always having to rely on something like PPE? So these are the kinds of things and the kinds of guidelines that we're thinking about to be able to provide. But right now, these places are not open. When they will be open, there will be more guidance for some of these places, and not all of the guidance will rely on PPEs.
Okay, so we just have about 2 minutes left. So doctor, I'd actually like to ask you, do you have a message that you would like to send to the people of Toronto? Anything you'd like to say to them, whether to reassure them or whether to give them some information?
Yeah, I mean, it's the long weekend coming up, and we definitely say, go outside for your physical and mental health, enjoy the outdoors, get some physical activity. Just make sure you keep that physical distance, stay within your household bubble, if you want to call it, go out with your household members, don't plan to meet up with others. And, that number of 5, not congregating in more than 5 is still something that we would recommend. And so we would still say avoid those non-essential trips, but still be able to enjoy being outdoors, but let's do it safely, so that we continue to protect ourselves and protect others.
Absolutely. Well, thank you so much again for joining us, Dr. Vinita Dubey. This was, again, very informative, and I'm sure everybody loved getting their questions answered directly from you. Hopefully we'll see you again soon.
Okay, my pleasure. Have a good afternoon, everyone.
Thank you so much. Okay, bye-bye.
Bye-bye.